Here we have axial and coronal CT images through the facial bones in a 58-year-old female status post-fall. This is a trauma patient. While scrolling through the axial images, we already notice that there are multiple fractures here. There's a fracture of the anterior wall of the maxillary sinus. There's a fracture of the lateral wall of the maxillary sinus. There's a fracture of the zygomatic arch here. There's a fracture of the lateral wall of the orbit on the left side. And looking at the coronal, we have a fracture of the inferior orbital wall here. These 5 fractures, when combined together, represent a zygomatic-maxillary complex fracture, or a ZMC type fracture. This patient also had an additional fracture, a fracture of the coronoid process of the mandible on the left side, which was separate from the ZMC fracture. So a ZMC fracture is essentially a fracture of 5 different bones, essentially. The anterior wall of the maxillary sinus, the lateral wall of the maxillary sinus, the zygomatic arch, the lateral orbital wall, as well as the orbital floor. So those 5, when seen together, represent a ZMC type of fracture. These fractures are the second most common type of fracture seen in trauma after nasal bone trauma. So they're very common, and you will see them during a trauma rotation or during nights. In addition, these fractures, depending on how comminuted they are, how angulated they are, may require surgical treatment. It's important also to, when looking at the ZMC fracture, to assess, because there is an orbital floor fracture, to assess if there is entrapment of the inferior rectus muscle or herniation of intraorbital contents into the maxillary sinus. In this case, there was none. We can see that the inferior rectus muscle is located in the appropriate position.